Aboriginal TV Channel 4, putting Aboriginal news first.
You are watching Aboriginal TV Channel 4 as well as listening to Larrakia Radio, going out to 26 communities across Darwin, as well as listening to Australian Indigenous Radio off the vast satellite 913, going out to 2,400 communities across Australia. My name is Rachel Chisholm, and on the phone with me now is Australian Federal Minister for Aboriginal Australians, Minister Ken Wyatt. Minister Wyatt, can you please talk to our listeners about the coronavirus?
Well, one of the concerns that we have is the coronavirus is transmissible human to human, and 8 out of 10 people will have flu-like symptoms, but 2 others will end up with life-threatening illnesses like advanced pneumonia. Mm-hmm. And what's important is that we try and protect everybody within our communities, because you know how we talk about caring and sharing, and we do it. This time what I want is to see people take care by avoiding contact with people who have coronavirus. Now, whilst it's in capital cities, that's good for remote communities, but the way we travel means there's a possibility that somebody could bring it into the top end and spread it through the region. And that's why I'm asking communities to remain within their communities and keep it that way. And anybody who comes to a community should only come if it's essential and it's an essential service, like police, nurses, school teachers, and other organisations that are important for the community's everyday business.
Mm-hmm. Minister Wyatt, can you please talk about social distancing? This is a phrase that we're hearing a lot in the news at the moment.
You know how when we see each other, we either give each other a hug or we shake hands? What we're suggesting is that you don't shake hands, because if you have the virus, it's on your hands. Mm-hmm. And by shaking hands with somebody, you pass it to them. So one of the strategies we're asking everybody to do is that if you do touch somebody or you shake their hands, that when you get a chance, or if you touch something where the virus might be, then you wash your hands and you wash them thoroughly with soap and water. But you wash in between your fingers as well. So, you know, when you join your hands together and you've got that, you put your fingers together and it reaches into those gaps between your fingers, you've got to wash in there as well. Yep. Wash them thoroughly and then rinse, sanitize your face, and don't touch your face with your hands.
Yeah.
Because it's easy just to rub your eye, not knowing that you might have the virus on your hand. But at the moment, communities in the NT are in a better position than people living in capital cities, because you don't have the level of exposure at the moment, but you could do with somebody who comes into your community, and that's why we're asking communities to remain self-contained.
As we all know, there are a lot of Aboriginal people in remote communities who need to go to vital services like kidney to renal clinics. How are we going to make sure that those people get the help they need while also maintaining a distance and safety to the other members of their community?
Well, what we're doing is those services will still be provided, but we're just asking people to take extra precautions. You know how sometimes when you walk into a hospital, there's this plastic container, and when you squeeze it, you get this alcohol fluid on your hand, or it's a clear liquid. What you do is you squirt that in your hand, rub and wash your hands, and then you go in for treatment. If they worry about you, they will give you a mask to wear, but that's unlikely. But all health treatments will be fine, because the health services and community-controlled health organisations and renal disease centres are all trained medical staff who know what to do. So you will be safe in their hands. Yeah. And even if you're feeling ill, tell your community-controlled health service or your health service so they can check you to make sure that you're okay, because some of us will have flus, which is not COVID-19. But I would still get it checked, because it's important that we check our health.
Can you go into depth, Minister Wyatt, about other measures to protect vulnerable people?
what I do want us to think about is the elderly
Mm-hmm.
or people who've got kidney disease or who have heart disease. But if we don't feel well, then we shouldn't go near them.
Yeah.
If they're in aged care, what we should do is only one person from the family go in and see that family member to prevent the spread of any illnesses to people in aged care. Because what we do know is children seem to be fairly resilient to it or fairly strong in the way it doesn't seem to impact on them as much if they end up with the virus. But older people like myself who are over 60, then we are vulnerable. And that's why we need to look after our older people, because it's absolutely important. And if there's elderly people or elders, then what we should do is keep a social distance so we don't infect them, because we want them to be around for a long time.
In regards to, as we all know, a lot of events here in the Northern Territory are starting to get cancelled, especially events that happen in our communities. What is going to happen in regards to local economy?
What we're trying to do is make sure that our programs remain normal.
Mm-hmm.
We are providing an additional $750 into people's bank accounts. And the reason we're giving you $750 is that we want you to be able to use that for medications.
Mm-hmm.
So if you've got a child with asthma, then you can buy you can get the extra asthma puffer.
Yeah.
To buy additional food, because we just want to make sure that there's food on the table, medicines for those who are ill, and then some extra money should something happen.
Yeah.
And that's important. That's why we're giving everybody $750. And what I want you to think about is shop at your local shops. By shopping at your local shops, it means you keep that business going.
Yeah.
And Outback stores, the support programs will remain normal. And if there is somebody with an illness, what we have to do is get them to isolate themselves away from everybody else.
Yeah.
So that they're cocooned, so they're in a place by themselves for 2 weeks, what we call isolation.
Mm-hmm.
And then our agency will work with communities. So our regional managers will be told, and then they will organise, along with the Northern Territory Government, the way in which we best respond to help a community anywhere.
Yeah.
The important thing that I really appreciate the Northern Territory Government doing is putting out the messages in language.
Yeah.
And your radio program putting out messages in language is going to be extremely important in reducing the impact of coronavirus on our people and on our communities.
Also, I've just got to ask you, in regards to a lot of people, as we know, across the nation are panic buying. What do you think people in the community should be doing in regards to food supplies?
I think the thing that's important for us is that we remember and respect that there are others who need the same food, same toilet papers, tissues or whatever.
Mm-hmm.
And if we just take what we need and not do this panic buying we're seeing in capital cities, then it means everybody shares whatever is in that community store.
Yep.
Capital cities, we've seen Australians do things I never thought I would see, and that is this panic buying. And if you go into shops here, there's no toilet paper.
Mm-hmm.
There's no meat on their shelves. Now, communities are not like that. So all I would ask you to do is to think about what you actually need and what other members in the community need.
Right.
And the supply chain, what we call supply chains, in other words, getting stuff to stores, we will leave to the right people to do that, but our agency will help if there's shortages. So we're looking at that issue as well.
Yep.
Because it's important we have food on our table.
Very, very much so.
Look, I think the most important thing is if somebody comes into your community and they're not well, get them to go to the nurse or to the clinic or to a health person. And what we mustn't do is think that it's coronavirus. It could be just a head cold.
Yeah.
But we've got to give them the chance. And we also have to say to them, we want you isolated for the next 2 weeks. You go and live in that house by yourself and have nobody there, and don't you come out.
Yeah.
Because if they don't have virus, then they'll be fine.
Yeah.
If they have, then we've kept it contained in that house.
Yeah.
But the community has to be watching, and just remember, if you have a concern, contact Northern Territory health people and people in your clinics, or the Aboriginal Community Controlled Health Services, or the National Indigenous Australians Agency.
Yeah.
All three of us will work together to make sure we get better outcomes for our people during this time.
Yeah. Minister Wyatt, are there going to be any services to offer people help to get back on country?
Actually, we'll be looking at all of those case by case, and I know that each day at 11 o'clock now, I'll be talking to key leaders in the National Indigenous Agency to talk about what we're going to be doing.
Mm-hmm. Mm-hmm.
And part of that is I want community to take notice of the messages that come from the Prime Minister or from Minister Hunt, because he's the Minister for Health, or the Chief Medical Officer, Brendan Murphy, who speaks on behalf of the Commonwealth, or in the case of the Territory, you have Minister Natasha Files, who is the Health Minister, or your Chief Medical Officer, because those people will have the right information that can best inform our communities in the Territory.
Yeah.
Don't listen to things that are on Facebook or on Twitter, because some of that information is not correct, and we do know there are scams where people are saying, I've got a cure, when in fact it's not a cure, but they want you to pay for it.
Yeah.
Don't fall for that trick.
Yeah. Minister Wyatt, at the moment across Australia, schools are not being closed, but we are coming up to the Easter holidays. Now, in Darwin, in the Northern Territory and in remote regions, we have our kids going to boarding school. What are they going to do during the Easter period? Should they go back to the communities? What's going on there?
Now, what we know and what we're doing is we've already had 500 young people in boarding facilities whose communities have asked for them to come back to community, so we're making that happen.
Okay.
And if there are others who want to come back, they'll come back, but we've also got to make sure that they're well.
Yes. Yes.
And so when they come back to community, they're well. And I don't have any major concerns about our young people in boarding schools, but we just want to be safe and make sure that kids come back to family, but they come back well.
We did talk about services that are going out that are still available in the communities, but what other services will be available to our Indigenous elders and those who are with disabilities living remotely?
Well, I know when I was talking to the Minister for Disabilities, he said on their website they have got information that community-controlled health organisations or health systems can access information, plus your case managers will know what they can do to help somebody with a disability. But government services will still remain the same, but the Commonwealth have provided additional money for the ACHOs to work very closely with Aboriginal communities, and there is about $100 million that's been set aside to bring people out of community if they get seriously ill.
Yeah.
So we've been thinking about our communities and ways that we can support them. There's also some respiratory units that if somebody ends up with pneumonia, then there's a respiratory program that will work with those very seriously ill people to make sure that we give them the best possible service. There's an announcement on Friday by the Prime Minister to do with our communities, and it will be about every community is in our thinking, and the Prime Minister has raised with myself, Minister Hunt, and with Cabinet, the need for all of us to think about what support and what help we give a community where there is a problem.
Yeah. It's also been raised in some circles. If the people have been predicting that this is going to last more than a couple of months, like 6 months at least, and people are are wondering if they have to come in from the communities into the cities, will there be accommodation for individuals and their families?
Not that I'm aware of, other than the normal accommodation that people stay in. For example, if you've got Aboriginal hostels, and there's certainly those.
Yeah.
As for other programs across the country, you would have to look at it state by state, territory by territory.
Yeah.
Yeah, now we had to talk about it briefly this morning. One of my team raised that issue, and that's something now that's in our thinking as to what we can do. That has to be considered in what's available, and that's part of the challenge. It's like when a community goes into, say, Alice Springs for a major festival, or the Alice Springs show or rodeo, whatever it is. People tend to come in and they camp.
Yeah.
My advice would be, I wouldn't worry. I would stay in my community.
Yeah.
If it was me, I would want to stay in my community and remain safe from this virus.
Yeah.
And just be very careful. And let's look after each other. That's what's important.
Yeah. You spoke about it before. There is a lot of false information going around on social media, but there has been a lot of posts in regards to price gouging in our community stores when it comes to hand sanitizers and other products to keep community safe. Is the government aware of this, or going to do anything to make sure that Aboriginal people in communities aren't exploited by community stores?
Yeah, I think our community stores will do what is best for the community, but price gouging shouldn't happen. But you know, the best thing to use is soap and water.
Yeah.
Or you can use dishwashing detergent and wash your hands with that as well if you don't have the soap readily available.
Yeah.
Both will clean your hands thoroughly. And when you wash them, take about a minute to really wash your hands properly.
Yeah.
Don't just dabble it under the water and then put it out as though you're scared of the water.
Yeah.
Put it in there and enjoy washing your hands.
Yeah.
Now, if there is price gouging, Rachel, then I want communities to tell my regional managers, tell the regional managers of the National Indigenous Agency, so we can see what it is and what's causing that. Because one of it might be supply.
Yeah.
When you don't have the supply chain, people sometimes put prices up because they know people will pay a higher price. That's not the intention that we should have. We should be providing things at normal price. Unless the shop is paying more for it, then it has to put the price up if it's paying more.
Yeah.
Yeah, with that $750, support your family, buy your medications, buy more food.
Is that just a one-off payment, that $750?
Yes, it is. It's designed to help keep families supported.
Yeah.
And secondly, to help the community store to have cash spent at it.
Yeah.
And to keep your store strong and viable.
And to keep that local economy happening through this bit of a tough time. Thank you, Minister Wyatt, for taking time out of your busy schedule to talk to me and our audience here at Larrakia Radio, as well as Australian Indigenous Radio and Aboriginal TV Channel 4.
It's always a pleasure to talk to you and to your listeners, because it's important we share information that we have so our people have an understanding, but listen to the messages in language because they're absolutely important.
Thank you again, Minister Wyatt, for talking to me today.
All right, take care.
Aboriginal TV Channel 4, putting Aboriginal news first.